children, notwithstanding the differences in our culture and creeds. Endow us with a desire to serve our fellow men, remembering that we too often need help. Whenever or wherever the need for service arises, help us to be ready to serve, endeavoring to make our badge of inner weal worthwhile, ensuring that we have not lived in vain. Thank you.
Thank you. Thank you, Shireen. And now the program goes like this. There will be a welcome by myself. I am Dr. Lalita, President of Inner Wheel Club of Trivandrum. I will be explaining the purpose of this program. And Dr. Radha Kumari will be introduced by Dr. Rekha Manoj, another of our member and who is working in Anandapuri hospitals. Then we'll right away start the session. So now, guest speaker of the day, Professor Dr. Radha Kumari, Sri Shivanji Nair, and esteemed members of our club, all the distinguished guests, and my dear friends. A very good evening to you all. It gives me immense pleasure to welcome you all to this talk on cervical cancer prediction and prevention by Dr. Radha Kumari. Worldwide, cervical cancer is the fourth most common cancer, and mortality is high due mainly to diagnosis at the late stage of the disease, and the treatment is also frequently unavailable, inaccessible, or unaffordable. Yet, cervical cancer is the only cancer that is preventable with early detection through screening and HPV vaccination. Thus, it is no wonder Inner Wheel, which always stands for friendship and service, took it up as a priority this month. January being the Cervical Cancer Awareness Month, Inner Wheel is organizing such awareness programs in the first 10 days of January to coincide with the International Inner Wheel Day on January 10th. We have been lucky to have a prominent gynecologist such as Professor Dr. Radha Kumari to deliver a talk on this topic today. I am happy to inform you that Doctor is also a long-standing member of Inner Wheel Club of Trivandrum. On behalf of Inner Wheel Club of Trivandrum and the Global Institute of Public Health, I extend a very warm welcome to Dr. Radha Kumari. We have been really fortunate to have Global Institute of Public Health, Anandapuri Hospitals and Research Institute as our partner in this public health initiative. We appreciate their readiness to host this program. I extend a warm welcome to Dr. Anand, Sri Shivanji Nair, and other authorities from Anandapuri Hospital, and hope we will have similar ventures in future as well. Welcome to them. I see that many stalwarts from Inner Wheel. I could see our PDC Jaya Chandrahasan there, are all there. Many from banks, Christnagar School and other institutions are also here. And I welcome you one and all to this meaningful program. Welcome you, I welcome you all once again. Thank you. I now call upon Dr. Rekha Manoj to introduce our esteemed guest speaker, Dr. Radha Kumari. Over to you, Dr. Rekha.
Thank you, Lalita. I thank the organizers for entrusting me with the pleasant task of introducing an eminent personality, Dr. Radha Kumari. Dr. Radha Kumari is one of the senior-most gynecologists in the state today. She started her career in 1956 when she joined Government Medical College Trivandrum after completing her bachelor's degree in science from Government Women's College. She completed her post-graduation in obstetrics and gynecology in the year 1965, after which she joined as faculty in the government sector in Kerala. She started her teaching career as a tutor in Government Medical College Calicut in the year 1965 And after a long service of 27 years, she retired from SAT Hospital Trivandrum in the year 1992. After retirement, she continued her services with the private sector. She joined GG Hospital Trivandrum as a senior consultant, where she served for 18 years, and then at Anantapuri Hospital and Research Institute Trivandrum till 2021. During her career, she was trained in laparoscopic surgery and microsurgeries. She had participated in numerous research programs and has presented many research papers as well. She was a very popular gynecologist, which is in the city, which was very evident from the busy practice she had. She was also a very loved and respected teacher. Today, she will be speaking on cervical cancer, its predictions and prevention. And I don't think we could have had a better speaker for today's topic. I welcome you, Madam, to today's webinar. Thank you.
Thank you, and for that.
Thank you, Dr. Rekha. Now I invite Dr. Radha Kumari to start the session. Doctor, now it is all yours.
Friends,
The platform.
friends. So it's the most cervical the cancer that kills women in India. 1/3 the cancer is due to cancer cervix. When you come to the world the statistics, the burden of cancer cervix all over the world, 1/4 is contributed by India. And now we find that cancer cervix, the only cervix that can be predicted and prevented. That's what I want to emphasize. It's a cancer that can be predicted. It is a cancer that can be prevented. Now, the one word, because I don't know whether you are interested, one word about what happens in cancer. The cancer is due to during the division of cells. Things can occur in the nucleus that can lead to a cancer. You know, we are all born with cells, and none of us have those cells still with us. Periodically, the cells are replaced. Every day, 3 billion cells are being produced, which replaces the old cells. And how does this happen? The old cells, they divide to produce new cells or daughter cells. The division of cells, cell division. And cell division is controlled, by the nucleus of a cell. Many of you are science graduates or had learned it in biology. Cell has got a center, the nucleus, which acts as the brain and which gives the orders to the cell, and the cell does its job from the orders that the cell receives from the nucleus. And the nucleus, as you know, contains the genetic material of the human being or any other cell for that matter. They are inside the chromosome. In the human, there are 23 pairs of autosomes and 1 pair of sex chromosomes, which are identical in the female, the X chromosomes, and the male, it is X and Y. So these cells are the division of the cells is because all the cells of the body are not being replaced continuously. There are certain cells that are programmed to multiply by itself without any prompting. That is the blood cells. They have to be continuously renewed to continue the blood supply to the body. Then cells of the skin, they are also being continuously replaced. The cells lining the intestines, they are also has been continuously renewed. They are programmed to do that. They don't require any prompting for division. But the other cells, they require an external stimulus to divide. And usually the external stimulus may be a wound, it may be an infection like a viral infection that destroys the cells, and then the cell starts its division. So the orders are given by the nucleus. The nucleus gives its orders and the cell division starts. So the function of the cell division is to produce two identical or daughter cells from a single cell. So the first thing that the cell orders, or rather the nucleus orders, is double up the nutrients, because now it's not going to be one cell, it is going to be two cells. So nutrients must be collected inside the cell. Then once the nutrients are collected, then the next thing that happens is the cell divides into two. So how do they do it? These chromosomes, so the genetic material or the genes are packed inside the chromosomes. Okay, but the 25 pair of chromosomes, or rather 24 pairs of chromosomes, are packed with genetic material or genes. They enlarge because they get now sufficient nutrients, and then they divide. They divide so that each daughter cell receives equal number of the genes, the same amount of genetic material. So once the cell has the nucleus is divided, then what happens is the cell has to divide. Then these two the parts of the nucleus move apart, and then followed by the cell that also divides into two, and then the cell division is complete. Now this is a process not left unchecked. It's tightly checked. So the first checkpoint is when the nucleus orders the cell to increase its nutrient content. And there are the mechanisms to check whether these nutrients are sufficient. And there are the two proteins, P53 and P25. These are the two proteins that checks that there is sufficient nutrients inside the cell to produce two identical daughter cells. If the amount of nutrients are insufficient, then what happens is for the time being the cell division stopped till the cell accumulates sufficient nutrients. Then what happens is the second checkpoint occurs when the chromosomes are divided into daughter cells. At the end of the division of the daughter cells, again the same chromosomes, the same genes, P17, P53 and P21, checks the cells to see whether both the daughter cells are getting equal number of chromosomes, equal number of genes, and then only the process proceeds. And if the genes are also checked to see whether they are normal or abnormal. Any abnormality, the same proteins try to correct it. The proteins fail to correct it. Then what they do is they ask the cell to die, to commit suicide. And then the next check occurs when the nucleus divides into two and separates. That also is checked by these two genes, P53 and P21, to make sure. So they have to be the two divided cells should come in line with the poles of the cell, so that they can easily move apart and the cell can be divided exactly into two. This process also is checked and rechecked. If something goes wrong, the cell is not allowed to continue, then the cell is asked to commit suicide. So this is a very tightly processed form of the cell division. So then what happens? Why should we get a cancer when so many checkpoints are there for any cell division? So what happens is these enzymes, these genes, the P53 and P21 may get mutated in some people. They have inherited a mutant gene. It is incapable of producing or checking the division of cells. So when these are not there, what happens? All the checking that happens does not take place. And some of the cells becomes cancerous. And they can divide, the cancer cells go on dividing and produce the frank cancer. The mutation may be hereditary. You might have heard breast cancer and colon cancer being the hereditary. That is, the gene is being transmitted to the next generation. The second, maybe because we are now exposed to so many the external carcinogen, smoking, then other agents that are found in the atmosphere or in all the materials that we use, the plastics and things that we use, can produce a mutation of this gene. If these genes are mutated, what will happen? The checking does not take place. Abnormal cells are allowed to multiply. So also, old cells are also allowed to multiply. Old people just like me, they are not completely functioning. There is something wrong somewhere. In the cells also the same thing happens. These cells are removed by again the same gene P53 and P21. So how do you know? How does the cell know that it's getting old? Here, the cell division is they are programmed. Every cell is programmed to have so many divisions. It can undergo only so many times it can divide. So the number of divisions each cell will undergo will differ, but it's programmed that so many divisions can only take place. So what will happen is the cell, if the division and how this how this is confined to the number of cells. The cells, how does division, the number of divisions that occur in a cell is so fixed. So every chromosome has got a cap acting at the end of the chromosome. What it does is it protects the genes inside from getting damaged. And this is known as telomere. That portion of the chromosome is known as telomere. And after every division, the telomere decreases in size. So after several, whatever it is, the number of the telomere, after the number of divisions that the cell can undergo, so it's already programmed. This cell will undergo about 50 divisions. Then you find at the end of it, the length of the telomere is so that it cannot divide anymore. So these cells are identified by our P53 and P21. But then what does the cancer do? The cancer tries to be smart. It produces a enzyme, telomerase. What it does is it adds genetic material to the telomere. So the telomere goes on. The length never decreases. It never comes so short to avoid a division. And thus the cancer cell becomes immortal. So it doesn't die. So that is why, see, it goes on increasing and increasing and increasing. The goes on increasing. Then what else does it do? How does it? What that they? See, the normal cell typically follow this typical cycle. It grows, it divides, and then it dies. So it functions and then it dies. But the cancer cell does not follow this cycle. It goes on dividing continuously. In the cell, that the cell when it goes on dividing, it cannot mature. So it cannot. The only the mature cell can perform its function that it's supposed to do. For example, leukemia. See, the number of leukemia cells will be several times of what is normal. But when leukemia occurs, the cells are so many, but they are all immature. What we call in medical terms is undifferentiated. They cannot produce anything to help the body. And the function of the white cell is to prevent infection, so that these cells cannot do. So the normal cell will grow, divide and die. But this one will grow and never die. And what happens when they grow and never die? So space is so limited, there are other cells around the place, so the abnormal cells gets piled up to form a growth. So that is how the cancer becomes a growth. Then for a growing growth, it requires blood supply. It cannot grow without being supplied by blood and nutrients. The vessels that are normally supplying that body part is not sufficient for this. The rapidly growing, voraciously growing, demanding nutrients. So what it does is it produces an enzyme called angiotensin, and makes the surrounding cells to produce new blood vessels. That is why most of the cancer patients will have bleeding as a symptom, because they have got more blood vessels in them. Second thing is, they deprive the rest of the body from the nutrients, oxygen for its growth. In the result, as a result, what will happen? The body becomes weak, emaciated, the patient becomes anemic, there's fatigue. So, in the end, the patient dies. The third thing is, see, normally we said a wound occurs, the cells surrounding it will grow, and the moment and it knows that enough cells have been produced to cover that wound, the growth or division will stop. But cancer cells never does that. It goes on piling up. Cells on top and on top and on top. As I said, earlier, mature cells have got specific function which cancer cells does not have. So cancer of the thyroid, thyroid normally produces thyroxine, necessary hormone. The thyroid will become very much enlarged in cancer, but it cannot produce the thyroxine because it's incapable, it's immature. We call it undifferentiated. Well, the cancer cells can be ഞാൻ മുമ്പ് സെഷനിൽ അടുത്തതായിക്കോട്ടെ. So the first part of my talk is cancer can be predicted, and this is the person who discovered it for the first time, Giorgio Papinicolo. What he accidentally detected was he took just a smear with a wooden spatula from the cancer cervix in a woman. He looked at it under the microscope. He found that that smear contained abnormal cells. And these abnormal cells can be identified under the microscope. Normally, the normal cell, every organ will have different different shapes of cells. But for for every organ, the cell shape will be the same in normal. Then second thing is the cells, as you know, have got a nucleus, a cytoplasm, and there is a definite nuclear cytoplasmic ratio, and the nucleus is smaller compared to the cytoplasm. But in cases of cancer, what happens is the nucleus is much more predominant, while the cell cytoplasm is much less. Then the nucleus is hyperchromatic because it contains more of DNA. So any trained pathologist will be able to look at the slide and say these cells are malignant or cancerous, but the other cells are normal. So if you can get a smear from the cancerous growth, you can predict that this is cancer without even a biopsy, or you can suspect that this is likely to be a cancer. For that, the organ should be accessible. Few internal organs are accessible to get a smear, isn't it? Excepting the mouth and the cervix. The cervix, as you know, in the gynecologist's armamentarium, we have got an instrument called speculum, which you can put into the vagina. Just depress it, you can have a look at the cervix. You can digitally examine the cervix. You can take a smear from the cervix. You don't require any the costly equipments, costly methods. Why? If you want to have to take a sample of stomach cancer, would you have to have endoscopy, or you may have to do other methods to obtain a sample of cells from any other internal organ. So that makes the cancer cervix very easier to access, and the person who first discovered it is Papinicolo. He was a Greek gynecologist. So first he discovered that the cells are abnormal and it can be detected in the smear. Second thing he did was, once he detected a cancer cell in a cancer cervix, he started examining all the gynecological patients with a smear. Then he discovered that in course of time, changes occurred in the cell, in a pap smear, in that smear, which slowly progressed and finally became cancers. So that is the reason why I said cancer is predictable. And so what Papinicolo advised was every 3 months, every 3 years, if you can have a pap smear done, very simple procedure, not painful, it can be done in 5 minutes time in a gynecologist's office, and the smear is stained and examined by a pathologist. If there are no cells, no abnormal cells are seen in that cell, you can rest assured that the next 3 years the cervix you are not going to get a cancer of the cervix. If on the other hand, if some changes are there, that doesn't mean immediately you are going to get a cancer. No. It takes 10 to 15 years for an abnormal change to progress on to a invasive cancer. So you can be periodically examined every 3 years or 5 years with a pap smear, and then you can be assured whether you are going to develop it. Right. So that is, we said that it is a predictable cancer. So no other cancer in the body can have this opportunity to detect cancer in its early stage. In what is happening is, in the Western world, every woman beyond the age of 21 is advised to have a pap smear once in 3 years till the age of 65. If you don't become, if no abnormality are seen in these cells, after the age of 65, you can stop doing the pap smear. So that can detect the cancer. And one more thing interesting in his Patrick is, even though he was a Greek physician, he emigrated to USA, and he was twice recommended for the Nobel Prize, but he was not given the Nobel Prize by the Nobel Committee. And but every gynecologist who prescribes for a pap smear in a woman is honoring him for his time. And every woman whose pap smear is found to be negative should be thanking him for this wonderful discovery that he has made. Now that is prediction. Next thing I said is prevention. So when I was a student, a medical student, so cancer cervix was were there. Most patients coming to the OPD, we all knew cancer cervix, and we all knew that cancer occurs only in women who have had sexual contacts, and it is more often seen in sex workers who they come in contact with multiple sex partners. So we all believe that semen contains some material, the element that is producing the cancer of the cervix. But we didn't know what it is. With all the microscopes that we were available at that time, we would not be able to find out the causative factor till the development of electron microscope. The electron microscopy told us that the eluding the element was known as a human papilloma virus, HPV. It's totally known as HPV, human papilloma virus. It's a widely spread virus. 80% of the people who are sexually active are infected by papilloma virus. There are, as like our coronavirus only have got only few types. This particular virus has 100 types. All of them are not malignant, that does not produce malignancy. A handful of them, 10 of them produces cancer. And among this, the most virulent are the type 16 and 18. And then a few others. And there is it also produces cancer of not only of the cancer of the cervix, it can produce cancer of the vagina, cancer vulva, cancer anus and oral if the person is indulging in anal or oral sex. It can also affect men. It can produce any. Yeah. It produces anal oral cancer in men. And because it is sexually transmitted, it's widespread. So what happens when the person gets a contact with a infected person? He or she develops it, the cells are affected, but it does not immediately produce any cancer stage. It takes 10 to 15 years for that infection to produce changes. But meanwhile, our immune system tries to get rid of it. Is within 1 to 3 years, the immune system will get rid of the virus in the majority of cases. That is why even though 80% of the women are infected with this virus or the form of virus, its various types, but the incidence of cancer is low. And so the one disadvantage of the virus is it remains there in the cell. The body tries to get rid of it. Usually, in the majority of cases, in 1 to 2 years' time, the virus is removed from the body. But if it persists, if our immune system is incapable of removing it, then it produces permanent change in the cells. That will slowly progress to a cancer. And there is no treatment for papilloma virus or HPV. That is the disadvantage. So what do? It's a cancer growth. It's a low the developing cancer rate. That's a very highly prevalent cancer. Then how are we going to manage it? We have discovered that vaccination is possible. Just as we vaccinate for the various diseases, the HPV can also be given vaccination. It can be prevented by vaccination. But it cannot be given to any person and immediately. It should be given at the age of 10 to 12. Before the child is exposed to sexual activity. So it should be given between 10 and 12 years. And there are two ways. If you are giving it between 10 and 12, it can be given up to the age of 21. You give 2 doses. At the first dose and a month later, the second dose. That gives permanent immunity. But this immunity is, the vaccine is only against a few types of viruses. There's a bivalent the vaccine, there's a quadrivalent vaccine, and there is a 9, what you call, I don't know. There's a 9-valent vaccine. The bivalent vaccine is against only the most virulent of virus, that is 16 and 18. It prevents 16 and 18 viruses. But the quadrivalent, it also prevents us against 6 and 11. 6, 11, 16 and 18. 6 and 11, what happens is 6 and 11 produces genital warts. So the mouth and throat warts, they can also be prevented by 6 and 11. But there are some other types like 30 and 36, and then I think 24 or something. And they have produced vaccine against these also. And it's not available in India, but the other 2 are available in India also. So if you have not taken the vaccine by the age of 21, you can still take it up to the age of 26. But then you have to take 3 doses. First dose, second dose, and the third dose. In the patient, even if the woman is after the age of 26, usually this vaccine is not given. So up to the age of 26, even if the patient had sexual the contact before, which is given because he or she may be infected with one type of virus. So, but this one will prevent, and may not be the severe type of cancer producing virus. But if you give, he or she may not have this virus. So, to prevent cancer in the women, it's not only the women who should get vaccinated, the men also should get vaccinated. That only will prevent the cancer growth, the incidence of cancer. The problem with vaccine is, unless you start making in large bulk quantities, each vial now costs about 3,500 rupees. So it's a costly vaccine. So, but India is becoming prosperous, or in the course of time it will become prosperous, and probably as part of the other vaccines like polio, tetanus, and measles, etc. This also becomes a part of vaccination. So that is what I mean. My topic was prevention and prediction and prevention of cancer. But because it is cancer cervix, so I will just take another 1 or 2 minutes to tell you about what are the signs and symptoms of cancer cervix. The cancer we divide into pre-invasive cancer and then an invasive cancer. What do you mean by pre-invasive cancer? So those who had their biology classes, they will know the cells, every tissue is multi-layered. There are different layers. So also the cervix and the vagina, they are also lined by cells which are multi-layered. So in situ, and there is a basement membrane separating the epithelium or the surface lining from the depth of the cervix. Sorry. So when the cancer cell is confined to only the superficial cells, then you call it cancer in situ, or the in situ cancer. I mean, the short name we use is CIN. Then, once it breaks through the basement membrane, then becomes an invasive cancer. So, in situ cancer stage, you find only the cells are abnormal. It has not invaded into the basal cell. It can be treated and cured. So, lifelong cure is offered for those the cells are confined to the surface epithelium and not invading beyond it. But once the cells have invaded beyond the surface epithelium, beyond the basement membrane, then it becomes an invasive cancer. And vaccination then that is pre-invasive cancer. Then once the cancer has spread to the deeper structures, we define the cancer depending upon where all it went. But because it's invasive, it is invasive. Stage 1, it is still confined to the cervix, even though it is not confined to the epithelium, but it's still confined to the cervix. Then the stage 2, it gets spread to the uterus and upper part of the vagina. Stage 3, it spreads to the lower part of the vagina or the rest of the pelvic tissue. Stage 4 is spread to bladder, rectum, and faraway organs like bones, lungs, etc. Very extensive spread. Now, pre-invasive cancer. Pre-invasive cancer does not produce much symptoms. It does not produce specific symptoms. And the so the pre-invasive cancer treatment is, before you treat a pre-invasive cancer, what we want to do is we want to make sure that there is no invasion. Because if you just temporarily just do something, then the cancer will remain inside that and then it will spread. So what we want to do is to make sure that it is no longer has started invasion of the surrounding structures. There are different methods of finding out whether it's an invasive cancer or not. So one, to take a biopsy, multiple biopsies from the cervix. And how do you know where to get the biopsy from? You take a smear, and the smear comes is positive for malignant cells. Now, where did it come from? How do they recognize which area of the cervix is giving me the cells? So, earlier I said the cells are undifferentiated. They don't do the normal function. The cervical cells, stores starch, and starch, when touched and tied in, turns brown. So what do? You paint the cervix. The normal area will become brown. The abnormal areas will remain unstaged. So now you have the areas from which you take multiple biopsy to make sure that there's no invasion. So second method is you touch the cervix with acetic, to 3% acetic acid. The acetic acid, what does is the abnormal cells becomes white under acetic acid. So the paint the cervix with 3% acetic acid, wait for some time, take biopsies from these aceto-white areas and to rule out invasion. If you want to be much more safer, what you do is you can do what is known as an a cone biopsy. You remove the whole of that cervical tissue area, the mucous surface, the majority of the mucous area, extending a little into the cervical canal, remove it, and then send for pathology to see whether there is any invasion. But it's better that you do rule out invasion before we go in for this procedures. Next thing is you can examine the cervix under magnification. So the instrument is called a colposcope. Some of the hospitals have it. When I was in SAT, we had a colposcope and we were doing a colposcopic examination of all the cervixes that just come to our OPD to see whether any cancer cervix is occurred. And the first colposcopic the examination that we did myself, and there was a cytopathologist there. And then we did, and we found an area, a certified area. We took a biopsy here because he was a cytopathologist. He did a biopsy, and here it comes a carcinoma in situ. We were thrilled, and that made our day. And we decided that thereafter no cervix will be biopsy unless and while this was colposcopy was done. So we detected a cancer and we ruled out the cancer also with the colposcopy. When I was working in the SAT, we were doing at that time the cancer cervix surgical wing was not there. It started in RCC. So they were sending us patients. Those patients who required surgical treatment, they were sending to SAT. So as I was doing it, most of the cases landed up in my lab. One day we got a reference from RCC with the reference letter saying it's a biopsy report with carcinoma cervix and stage 1 for a young lady about 30, 25 to 30 years, somewhere a young pretty girl, and for a cancer surgery, so the mutilating completely. It destroys her sex life, completely destroyed her chance of conceiving, etc., etc. So before that, we have not seen, we have not looked through the colposcope at the cancer cervix. So that we will have a look at the cervix. We looked at it. They did not appear at all of what we thought about as a cancer cervix. So something is another picture. It is not cancer. Then see, we are all my knowledge of colposcopy was very limited, and it is a RCC that is sending us the report which is cancer. How can you? So one of the my uh, assistants was working in RCC. She said, "Man, I will go and find out what has happened." No, what has happened? The two patients, identical name, identical age, came to RCC. One was this patient, and there was another patient, titled same. She was reported as having a benign lesion in the cervix. So by the time they begin the then they restarted the values, they re-evaluated the cells, then they found that the one that was referred to us as cancer cervix was actually only a mild condition, and the other girl who really had a cancer cervix was reported as a mild condition and was sent home. So we called her back. This lady, we treated her for minor condition, and the other girl went for treatment with cancer cervix. So that was my. I mean, I remember, and you know, after when she went home after her treatment, etc., she gave me a packet of supplement. And then when we were there working there, tomorrow there the patients will come and give you presents. I don't remember any name at any patient who has given what they gave. But this I will never forget. This Kaplan was worth all that I have learned, I have studied, and I have practiced. Now coming back to the treatment cancer. So we say the invasion. So we rule out invasion by any of these methods. Once you rule out this method, now what is the treatment? CIN1, this early stage. See, only the deepermost cells are abnormal, and the degree of abnormality is minimal. The degree of abnormality of the nucleus is minimal, and the abnormal cells are confined only to the lower one third. Then they can be left alone for some time because as it is due to most of them are due to HPV infection, they get cleared up by itself. If it doesn't, then ask her to come back after 1 year, repeat, and if it persists, then you can, as we use the lugolcidine or acetic acid or colposcopy, and then destroy it. So that is all that the patient requires. But only thing is, once an abnormal smear is recorded, then they have like the lifelong evaluation every year. Or sorry, not every year, every 3 years. The cervix should be examined, pap smear should be taken until she is 65. And if no further occurrence in the condition, then she can stop having the pap smear after the age of 65. But if at any other time the condition recurs, then it's better that you get the uterus out. So because it might recur in some other stage. Then, if you find the CIN1, so very mild, then comes CIN2 and CIN3. CIN2 is 2/3 of the cells, multi-layered cells, 2/3 are affected, and there is more nuclear abnormality. They choose divisions, they choose multiple very abnormal cells similar to a cancer. So what you do is, there you can't leave them. It has to be treated. And methods of treatment are depending on one, you can use destroy the cells with cryo, that is intense cold, intense heat, cryosurgery, heat, electric surgery, or you can excise it, what is known as a leap or loop excision of the cervical epithelium. The older patients, those who give a history of cancer somewhere else in the body, etc., etc., then we remove the uterus inside. So CIN3 has to be treated because if you leave it, you don't know what stage of the cancer you have got it, and so the next week might turn invasive. So to avoid that, treatment is necessary, and CIN can be treated but group excision of a wide excision of the epithelium, or preferably a hysterectomy in an old age, but lifelong till 65, and if it remains negative, then you can stop there. Now, cancer cervix. Cancer cervix produces what symptoms does the cancer cervix produce? The early stages, she may not have any symptoms, but most often she has what is known as contact bleeding, coital bleeding. Postcoital bleeding she can have. When she strains its stool, she can have bleeding, on which is probably may not be very heavy, and the patient may ignore it. But the bleeding goes on increasing, and she may have continuous bleeding. Then the cells, because these cells becomes the piled up cells to the tumor, so becomes necrosed, and she has an offensive vaginal discharge. Then it invades the other organs. She may have difficult pain in the urination, pain in passing motion. It might produce a hole in the bladder or in the rectum, producing the leakage of urine and blood. She may have symptoms of distant metastasis, lung, liver, brain. So that's the last stage of fourth stage of the disease. The treatment of cancer cells. No, it doesn't be included in the topic because the topic was prediction and prevention. But even if I predict and diagnose it, then I have to at least I got to treat it also, isn't it? Cancer cervix, the early stages, the treatment is surgery. The surgery is not radical hysterectomy. So you remove the uterus, you remove the tubes, you remove the ovaries, you remove the upper portion of the vagina. Then in the structures that are attached to parametry. Then you also remove the glands, draining the cervix. They are all pelvic glands. The glands are not in the vulva or the vagina, it is inside the pelvis, inside the abdomen, so they have also to be lymphadenectomy. Once it becomes cancer too, it's no longer confined to the cervix, it has spread to the vagina, etc., etc. Surgery alone will not cure the patient, or at least with radical hysterectomy will not cure the patient. So the patient has to be, two options are there for the patient. One, radiation followed by surgery. So radiation, the radiation is in we give a external beam radiation or apply radial sources into the vagina, then special applicators are there. The radioactive substance is put inside them and kept in the vagina, close to the cervix and into the uterine cavity. So that is called brachytherapy. So you can give radiation, external beam radiation, and brachytherapy. Then they may also, because it might have spread to other structures, they may also require chemotherapy. Chemotherapeutic agents are there. Stage 3 cancer, so the surgical options are very limited. So the only treatment is radiation followed by chemotherapy. Then now the immunotherapy has come in, so in recurrent cancer, etc., they try immunotherapy. Now, what is the prognosis and life expectancy after you detect a cancer? Pre-invasive cancer, the normal life expectancy with regular surveillance, lifelong. Stage 1 and 2, there is 92% survival for 5 years. Stage 3, which has come from 92, it has come to 58, survival for 5 years. We don't promise that you will live the rest of your long life. We don't promise. Once it becomes an invasive cancer. Stage 3, 58% survive for 5 years. And when it comes to stage 4, where it has involved distant, only 15% survive for 5 years. So that's my hope. At least those who have earned it, at least they will vaccinate their children, they may not, but grandchildren, at least make them undergo vaccination, both male and female, so that we can get rid of this problem. Thank you very much for your patience. Session on the law.
Thank you, doctor. That was a very informative talk. And if you have any doubts, please, this is 15 minutes for question and answer session. I hope you don't mind, doctor.
Okay. If I can answer, I will.
That is it. You can ask. It's a question and answer session, interactive session. If any of you have doubts, please unmute yourself and then ask.
Video.
Okay, in that case, shall we assume that everyone has understood it properly? The stage by stage. So I would like to invite Shivanji Nair to propose the vote of thanks.
Good evening, esteemed members, as well as office bearers of the Club. It's indeed my privilege to be present here as the lone male, I guess, in the whole gathering, to represent Anatomy Hospital. In fact, one of the co-organizers of the talk. As I understand the participation, I had extended the invitation to clearly the Chrysler school teachers directly to their contact point to SBI, as well as Kerala government employees. I think maybe being a very, weekend, I guess the number of participants outside the innovative circle has not been that high, which we will certainly see what has happened on that one. But however, I think as a person who has attended this session, I feel I can, on behalf of all of you, certainly feel that man has gone a little bit more elaborate into basically the prediction and prevention of such a disease. I'm sure I, for a second, sometimes thought she actually went to a medical college teaching days. I'm sure, like when few people have the medical background and necessarily would have gasped most of the things that she has told. However, certainly, once again, I thank Innovative Club for taking the initiative as well as joining hands with us, making us a partner. This is the first program that we are interacting with the Innovative Club. So, first and foremost, I thank all the office bearers as well as members of the Innovative Club. Mrs. Shirin Hussain, who had actually told the prayer, and Dr. Lalita Ramakrishnan, who has been the background in the organizing of this program. Dr. Rekha, who had actually introduced the speaker. And on behalf of all of you, I also extend my heartfelt gratitude to Dr. Radha Kumari ma'am. I'm sure, like, considering her seniority, she has in fact, painstakingly done some active research as well as application and tried our best to simplify the topic. I'm sure we are indeed grateful and indebted to you, ma'am, for your valuable time and your so much of an output of knowledge. And the important factor is that the take-home message that cervical cancer can be predicted almost accurately as well as be prevented. Certainly is a very important relief for many people across. I'm sure that we would try to gather in more external participation in the coming future cooperative assignments we'll be having with the Innovate Club. But as a startup, for a startup, this has been our first program. I really thank all of you who have really spared your weekend time to get together for a knowledge session as such. And we look forward to doing such more programs in the. So once again, thank one and all for your participation as well as looking forward to greater associations in the coming year 2022. Thank you.
Thank you. So I think we'll close the program. Thank you. Thank you once again. Thank you, Dr. Radha Kumari. Thank you once again.